The ever-changing fight against COVID is changing again. Vaccinators have had to pivot a few times to figure out the best way to get shots in arms. And lately, there have been fewer and fewer people to vaccinate. But a local expert believes demand isn't gone for good. Amanda Quintana is here with what SSM Health is doing with all the leftover vaccine.
If you wanted a vaccine, you likely already got one, maybe even months ago. There have been mobile clinics to try to vaccinate people that were hesitant, but lately, few people who are seeking their first shot or even showing up.
We are in the process of shifting the vaccine from being offered at designated clinics to being part of primary care in general.
With about 1,000 Pfizer and 1,000 Johnson & Johnson doses left and many Moderna, SSM Health is expanding the locations you can get a vaccine.
When you go to visit your physician for an annual checkup or any other reason, the vaccine will be offered to you if your record shows that you haven't received it yet.
Regional VP of Pharmacy Services Mo Carbot hopes that getting the shot from your doctor, from someone and somewhere you're familiar with, might convince more people to get vaccinated.
We also this week began offering the vaccine to our hospital patients. So when a patient is in the hospital already for a surgical procedure or for any other medical condition, our physicians and nurses will offer the vaccine to them.
Even though demand is pretty low right now, going from 20,000 shots a week at its peak a few months ago to just 1,000 a week now at SSM, Carbot is confident demand will pick up again. The school year is less than 2 months away, and the FDA could fully approve the vaccines beyond emergency use.
We expect other employers and other institutions at some point to also make the vaccine mandatory. So I think there will be demand yet for the vaccine sometime this summer.
That timing, though, is pretty important. The Moderna shots expire in October, but there's a new way that vaccinators can share their leftovers.
There is now a portal where vaccinators can list the vaccines they have, so vaccinators can get the vaccine doses from each other.
That'll make it much easier for the state to use up the doses that we already have here before they expire instead of ordering more from the federal government.